Well, tonight we hear from the Assistant Secretary for Health, Admiral Brett Giroir, on the state of the pandemic and the rollout of that coveted vaccine. I sat down with him earlier today to talk about where we stand now as a country as the Biden administration prepares to take over. Well, let's begin with the numbers. That's what everyone is kind of talking about right now, trying to quantify what's happening. In the last few months, President Trump said there'd be 100 million doses of the vaccine distributed by the end of the year. That number currently stands anywhere between 11 and 12 million. Secretary Azar said the goal was to get 20 million Americans vaccinated by the end of this year, meaning by the end of tomorrow. Right now, that number stands a little more than 2 million. So the narrative that's emerging is that all of this is behind pace in terms of what was promised. Is that true? If so, why? And should Americans be at all concerned?
So we've been quoting the same numbers for a few weeks right now. At the end of this week, we will have about 15.6 million doses distributed. That means that they are in the hands of the states, the pharmacies, the local health departments, exactly where they need to be. That 20 million number, it has been allocated, but the last few million won't be distributed until next week. That is the ground truth. Now, how many people have been vaccinated? We know by reporting it's been about 2.1 million people. We know that's an underestimate because that's a 2-day behind number, and those numbers lag between 3 and 4 days. So we know it's bigger than that, but it's much less than the 14 million that's already been distributed that we know is actually there. That will increase. Remember, we've only been vaccinating people for 16 days. We've had Christmas, 3 snowstorms. A lot has happened, and all vaccine programs start a little bit slowly, but we expect that to ramp up dramatically. For example, there were about 900 nursing homes or long-term care facilities done last week. We expect 4,000 to be done this week and that to increase. So you'll see those numbers going up dramatically.
I know the goal here publicly was 80% of the country vaccinated by the end of June. 80% of the country would be roughly 265 million people. Is that still the goal? Does that still seem realistic?
So I don't know that that was ever the goal. We don't have vaccines authorized yet for anybody under 16, and only one of the two is authorized for 16 to 18-year-olds. So what we are saying, and we do believe it's true, is that any person, adult in this country who wants a vaccine will be able to get it by June.
And Admiral, there was a report or several reports a few weeks ago about states being upset that they'd gotten less than they were promised, and reports that there were millions of Pfizer doses sitting in a warehouse waiting to be shipped. Pfizer kind of put the blame on the government kind of put the blame on Pfizer. Has that issue been resolved, and what do you want your message to be to governors who still feel like they haven't gotten everything they were promised?
So 2 separate issues. Let me be clear that 45 governors understood that preliminary planning scenarios back in November, before there were any vaccines authorized, is not an allocation. 45 governors understood that. 5 decided to make a political statement out of it. They know that on Tuesday, like yesterday, they will get the allocation for the following week. And that has been rock solid. So yesterday, 4.2 million were allocated. There was only a difference between a preliminary planning scenario and the actual allocation. Now, in terms of doses being in freezers, when you allocate on Tuesday, you can only allocate doses that have been manufactured and have achieved the appropriate quality. So that on a Tuesday gets allocated, the governors order it on a Thursday, and they start getting shipped on Friday, Saturday, Sunday for the next week. Now, if some more vaccine gets released on a Thursday or Friday, that is not going to be allocated until the following week. So nobody's really to blame for that. That's just the cadence. We can't allocate vaccines that are not released with quality. We just can't do that. And if a vaccine is released with quality, after we allocate it, waits for the next allocation. So Gotcha. That's where as far as we know, nobody's been short of vaccines. They've all got significant supply right now, and this pace will keep going and getting better all the time.
And the president recently tweeted that it really is the state's responsibility to distribute these vaccines. I'm trying to understand. We kind of saw this debate a few months ago at the start of the pandemic about PPE and testing, and what was the federal government's responsibility, what was the state responsibility. In a nutshell, as this vaccination, the largest ever in America, as you well know, rolls out, in a nutshell, explain what the feds are doing versus what the state responsibilities are.
what the federal government has done for vaccines is we've funded the development and manufacture, and we've expedited that. We've set the scientific and regulatory standards to make sure that all vaccines meet those. We've purchased vaccines and are distributing them equitably to all the states, along with all the supplies, all the needles, all the alcohol syringes. We work collaboratively with the states on their playbook. There is no federal workforce that goes in and vaccinates people. We work to enable the local plans, and the CDC put out that playbook in September with an update in October, and have been working daily on how states do this, what vaccine places are actually getting shipped, what pharmacies get it, what hospitals get it. That's the way we work that. We've also enabled a lot of the local vaccinations. For example, 99% of long-term care facilities will be vaccinated using a federal contract with CVS and Walgreens. I mentioned earlier that there's a federal contract for 70,000 pharmacies that the states can use. And we've done a lot of regulatory guidance to make sure that that happens. And then finally, we do put some boots on the ground. In addition to the National Guard, which are a state resource, my service, the Public Health Service, is also deploying to many places. Now, we've got limited people, right? Because we work in the Indian Health Service, in the prisons, and all over. But we do deploy to help vaccination. So it is not either or responsibility, it's a mutual shared responsibility according to the Emergency Response National Framework. And this is exactly what happened in H1N1. This is not a political decision. This is not an administration decision. It's the way public health works. Now, compared to H1N1, we've learned a lot of the mistakes, and there were many that happened then. But, that's what we do. We learn from previous experiences, like having uniform rules for who can vaccinate and how to distribute based on tiers of allocation as opposed to just all at once. So that's, in a nutshell, the way it works.
How concerned are you about a post-Christmas, post-New Year's surge, particularly with travel being high and this variant strain that now we have our first case in Colorado? That was a big story yesterday. How concerned are you?
Well, let me start with the second first. There are always mutations in viruses. Now, we don't expect massive mutations like we see in influenza, but there will be mutations. And we do believe, and there's good evidence right now, that this UK variant is more transmissible, meaning it's easier to pass the virus from one person to another, probably because the amount of virus in the people's noses are much higher. Therefore, there's more of a chance of transmitting it. We also know, though, that the new strain is not more severe. In other words, if you get it, it is not more severe, not any more likely to get you sicker, hospitalized, or to kill you. And finally, we fully expect that our vaccines will work against this new strain. We haven't proven that 100%, but based on everything we know about the vaccine, we believe that. So yes, we were concerned because it is more contagious, and that's why we all have to keep doing what we've been talking about doing, wearing a mask, watching your distance, washing your hands, and really avoiding indoor crowded spaces. The new variant will respond to that just like the old variant.
But certainly you're not happy with the idea that a couple thousand Americans are dying on a daily basis. We're still very much in the throes of this. Medically speaking,
we are in the throes of it. We are in the belly of the beast. We are in a dangerous and critical time in this pandemic. I will be happy when there are 0 cases and no one is at risk. I'm a clinician. I'm a critical care physician. These are not numbers to me. I tell you, every night it's difficult to sleep, and I wake up multiple times thinking of patients and their families at their bedside, or God forbid, not even being allowed to be in the ICUs. It's professional, it's personal. None of us are going to be happy until the last person tragically dies of this pandemic. The end is in sight with the vaccines, but what we do over the next few months will be the difference between tens of thousands of more people dying or them surviving and living a happy life. So I encourage all Americans to really do the mitigation steps, wear that mask, avoid indoor crowds, watch your distance, and avoid travel if you can. And if you can't, just make smarter choices and get tested.
And Admiral, President-elect Biden this week has been critical of the vaccine rollout. He said, quote, a vast new effort will happen once he is in office. His plan is to have 100 million vaccinations in his first 100 days. So basically 1 million people getting the shots a day for his first 100 days. Do you agree with that goal, and do you think it's realistic?
I think that goal is is actually a step back from our goals. We certainly expect to do 100 million doses in people's arms over 100 days starting next year. So I don't disagree with that, except I don't want him to turn Operation Warp Speed into Operation Go-Kart. We need to keep the speed up, keep the pace going, and I think we could do at least that well, if not better. I certainly agree with his urging of Americans to wear masks. I think that's a wonderful thing. I agree with him urging for us to work together as a nation. I certainly agree with that. But I don't think there's any change in terms of the goals, nor have I seen any specific ideas that would accelerate us. It's easy for people to say, well, we'll use the DPA. Operation Warp Speed has used the DPA 18 times. In testing, we've used it 13 times. If there's any specific action that the Biden administration, the transition team, or anyone has for us to accelerate that, we are open for business and want to hear it. We're all in this together. We have to come together as Americans. Public health is not political, and we need to continue as we're doing to fight this battle until it's over.
As you can imagine, very busy guy, so it's good to get about 10 minutes with him. Earlier today, there was an analysis, though, by a news organization that showed that at the current rate, to get 80% of the country vaccinated, it would take 10 years, which obviously is a crazy amount of time. But what he said repeatedly today was that this thing is going to ramp up big time in the weeks ahead, and they expect the numbers to go way up steadily. So we will see what the CDC reports as things progress.
A lot's going to have to happen to get that into 100 million people in 100 days.
Right.
There's no doubt about that. As he said, the pharmacies and everything else, all these other clinics that are going to have to be administering this vaccination, we have a long way to go, and it's been a slow start, but hopefully he's right and we'll ramp up as we move on.
We will see. A lot of questions. And we still don't know the main question about durability.
Right.
And how long you're protected for, and are you partially protected after just the first of the two shots? So lots of unknowns, but we're slowly getting there as we bid adieu to 2020.
Well, it's an interesting interview. Thanks, Rob.